Go ahead, ma'am.
Okay, so good afternoon, everyone. I'm Dr. Sayali. I'm the consultant and fertility specialist at Oasis Fertility Pune at the Karadi Center. So, welcome for today's Facebook Live session. And today we'll be dealing with another important topic, that is thin endometrium. So, what is thin endometrium? So, whenever a couple is seeking any form of fertility treatment, or whenever they're going for any monitoring in the form of ovulation induction, IUI, or the IVF cycle, they come across this term endometrium. They're usually told that the endometrium is good or they have a thin endometrium. So, what basically is the endometrium? The uterus is an organ which is going to carry your pregnancy, and it is going to support the your pregnancy till you deliver the baby. So this uterus is basically divided into three layers, that is the innermost layer, the outer layer, and the middle layer. So the innermost layer, which is usually going to nourish your pregnancy, it's going to support your pregnancy, it's going to provide all the blood flow and the nourishment to your baby. This is known as the endometrium. Now, what is thin endometrium? So, thin endometrium is any endometrial thickness that is less than 7 is considered to be thin endometrium. So, when we talk about the endometrium per se, you have to get a good endometrial thickness. That is a thickness that is above 7 Any endometrial thickness that lies between 8 to 12 is supposed to give the best pregnancy success or the best IVF results. And endometrial thickness needs to be at least 7 So the success of pregnancy declines if your thickness goes below 7 and the chances of attaining pregnancy are very low if the endometrial thickness is less than 6 So is it only the thickness of the endometrium that is important? Well, along with the thickness, you require a proper blood flow to the endometrium. The endometrium needs to have a good vascularity. And next is a proper pattern, that is a proper triple line of the endometrium should be maintained. So here we have to understand that even if individuals have a thin endometrium, that is if the thickness is less than 7 or even in individuals who have a thickness of less than 6 if the vascularity or the pattern of this endometrium is good, they are able to conceive. But again, if in individuals who have a thin endometrium, there is an increased risk of miscarriages in them. There is increased risk of placental problems that can result in preterm growth restricted babies. There's increased risk of hypertension in women who conceive with a thin endometrium. So these individuals ideally need to keep a good monitoring. They need to be on blood thinner so that a proper blood flow to this endometrium is maintained. So now we've spoken about thin endometrium. We've spoken about the requirement of the endometrial thickness, the proper blood flow to the endometrium needs to be maintained, and you require a good pattern of the endometrium. So what are the factors that causes the endometrium to be thin? Now here we have to understand that estrogen is a prime hormone in the body that is required to increase the thickness of the endometrium. Estrogen is a hormone that is required to maintain the endometrial thickness and to maintain the proper blood flow to this endometrium. Now, whenever a follicle in the ovary is growing from the second day of your menstrual cycle, this follicle grows, and when it reaches a size of around 12 to 14 it will start secreting a hormone that is known as estrogen. Now, this estrogen is basically going to act upon the endometrium and increase the thickness of endometrium. So in individuals who have irregular menstrual cycles, that is individuals who are like polycystic ovary individuals, in whom the follicles are not growing at the right pace, or individuals who have a very low reserve, that is the follicles do not grow, or the number of these follicles are very low, or the egg quality is low, in that case the estrogen is not secreted in adequate amounts, and this will result in a thin endometrium. Other factors such as when factors in which there is inadequate blood flow to the endometrium. So when you have conditions such as fibroids, or there is any form of intrauterine adhesion, so the proper blood flow to the endometrium is not maintained, so the endometrium is not going to increase in proper thickness. And another factor is when there is a damaged endometrium. If the individual has a history of any operative procedure, such as a medical termination of pregnancy was done, curating was done in the individual, or there is any form of infections, this is going to basically damage the endometrium. And therefore, the thickness as well as the vascularity component of the endometrium is going to be affected. So, as we have seen that factors such as abnormal periods, where you have irregular menstrual cycles which are not growing the follicles in the right way, infections in the form of previous history of tuberculosis, any pelvic inflammatory diseases, or any inflammatory conditions such as chronic endometritis, these are, basically going to damage the endometrium, and this is going to decrease the thickness as well as the vascularity of the endometrium. If you have undergone any procedures such as, repeated curetages, or any infections or inflammatory conditions are there, these can, result in adhesion formations in the endometrial lining, and they can also compromise the endometrial thickness and the blood flow. When individuals are undergoing repeated ovarian stimulation with a medicine that is known as clomiphene citrate, this can also compromise the endometrial thickness. Individuals who are on long-term, usage of these oral contraceptive pills, in these individuals also, because of, long-term suppression, the endometrial thickness can be of a lower side. Or individuals who basically have a poor quality of the endometrium. So if the endometrial tissue is poor, in that case also the thickness or the vascularity can be compromised. So these are the basic, various factors which are responsible for thin endometrium. So how does this individual who has thin endometrium present to you? Now, these individuals are usually going to have irregular periods. The periods are going to be painful. They come with, scanty blood flow. So when the lining of the uterus, that the endometrium is not growing adequately, it's not going to be shed adequately. So they have scanty periods, or they have, only spotting that is there. So these individuals, they present with irregular periods or scanty flow, or they're going to be presenting as infertility, or recurrent miscarriages. So how are you going to evaluate these individuals who come to you and who usually have a thin endometrium? How will you diagnose a thin endometrium? So basically, we can go ahead with a 2D sonography that can help us evaluate the endometrial thickness, and you can put in a Doppler and look for the vascularity component of the endometrial. So as we have seen that if the endometrial thickness is, less than 7 mm, and if the blood flow is compromised, then in that case the success chances of pregnancy will be on the lower side. When we do a 3D sonography, the 3D sonography is going to help us evaluate for the cavity. It is going to, help us know if there is any adhesions that are there in the cavity, or if there is any, septum or any form of Mullerian abnormalities in which the uterine cavity is not well formed, that can also result in a thin endometrium. Then other procedures such as a saline sonography, or a, hysterosalpingography. Now basically the dye or the fluid that is passed in these procedures, they are kind of unequally distributed, when the cavity is constricted, or when there are presence of adhesions. So these procedures can help us diagnose any form of adhesions that are there in the endometrial cavity. Next comes your hysteroscopy. That's a diagnostic procedure in which a, scope is passed through the cervical canal into the uterus, and with the help of this, we can diagnose what the problems are. We can come to know about the, cavity of the uterus, whether, it is properly roomy, or whether the blood flow to the uterus is good. We will come to know if there are any form of adhesions, any infection markers, any chronic endometritis evidence is there. Then all of these procedures, and all of these, reasons can be scanned by a hysteroscopy, and this can also be like a, therapeutic procedure. If any form of adhesions are there, we can, go ahead with removal of adhesions. If any form of, infection is there, we can go ahead with antibiotic treatment. We can, send the tissue. We can do a, endometrial biopsy and send this tissue for histopathological diagnosis. If you can diagnose small tubercles, or if you see that the cavity is very constricted, the similar endometrial tissue can be sent for a TB PCR analysis. Or if you see any evidence of chronic endometritis, you can, do the CD138 markers. So these, by a diagnostic hysteroscopy, we can find the various causes that are resulting in a thin endometrium, and, we can get it properly evaluated. So these are the various diagnostic procedures, which we can do, to diagnose a thin endometrium. So coming to the various treatment options. So an individual has been diagnosed with a thin endometrium. So how do we move ahead? Cannot this individual conceive naturally? So as we have already seen that if the endometrial thickness is 7 or above, the chances of conception and the chances of carrying the pregnancy to term and having a healthy baby and an uneventful pregnancy is on the higher side. But if your endometrial thickness lies between 6 to 7 then in these cases, we can go with estrogen supplementation. We can give estrogen medications in the form of, estradiol tablets, or we can give estrogel. We can help support the endometrium to build the endometrial thickness. Try to take it till a 7 mark at least. Ensure that the blood flow to the endometrium is good. To improve this blood flow component, we can even give them sildenafil tablet. We can start with a low dose of aspirin in these individuals, and try to attain a pregnancy by an ovulation monitoring or IUI cycles in these individuals. But if the individuals have very thin endometrium, even with the support of all these medications, if the individual endometrial thickness is not able to increase, then we have to go for advanced modalities of treatment in the form of IVF, and then going for a frozen embryo transfer in these individuals, where we can give the hormone replacement therapy in varied forms. So coming for the other treatment options of thin endometrium. So as we have seen that if the individual's endometrium is not growing adequately, estrogen is one of the prime hormone that is required for increasing the endometrial thickness. So we can supplement these individuals with estrogen in the form of estrogen tablets, in the form of, vaginal estrogen, or this estradiol gel that is available. Estrogen in the total dose of 16 milligram can be given to these individuals. Uh, then individuals who are coming for follicular monitoring, or taking some fertility treatment, so in these individuals we can give something that is known as the HMG injections. Now this HMG is going to basically act on the pituitary and cause the release of gonadotropins. These gonadotropins are going to act on your ovary, and they're going to cause the estrogen release. So this is an indirect way in which we can increase the estrogen in the body, by giving them gonadotropins, by making the quality of the follicle better, by making the follicle grow in a better way, and increasing the endogenously or naturally released estrogen from our body. Then there are some natural remedies, such as vitamins, such as vitamin E, asparagus, royal jelly, red clover, or the L-arginine. Now, these are the natural supplements that can increase the endometrial thickness and can increase the quality as well as the blood flow to the endometrium. Regular exercises, meditation, this is going to basically improve the blood flow to the endometrial, to the uterus, to the endometrium, and this is basically going to improve the endometrial thickness. Then, Ayurvedic treatment in the form of acupuncture, in the form of various fertility massages can be tried for. Now, as we have seen, we can move ahead with hysteroscopy. Now, in hysteroscopy, we have, discussed about the diagnostic options of hysteroscopy that are available. Now, in this, any form of abnormality, in the form of adhesions, we can go for adhesiolysis. Any form of infections that are there, we can, send a biopsy to screen for these infections. We can, start antibiotic treatment in their cases. If the cavity is constricted, we can go ahead with, a metroplasty procedure or scraping that can, help improve the thickness of the endometrium. Other factors, such as, to improve the blood flow to the endometrium, we can start them on the low dose aspirin medications, or we can start them on sildenafil medications. These basically help to improve the blood flow to the endometrium. So when the blood flow is improved, the endometrial thickness can also improve. Next is the granulocyte colony stimulating factor. Now, this is basically an infusion of GCSF can be done into the endometrial cavity, and this basically helps in improving the endometrial thickness, or it can help in improving the blood flow to the endometrium. Then there are other recent modalities, such as we can go for a PRP infusion. Now, your autologous blood plasma, which is enriched with our platelets, this is basically instilled into the endometrial cavity. So we can do an infusion of this PRP infusion, or we can directly inject this PRP, with the help of a needle under hysteroscopy guidance. Now, this PRP is going to basically, these platelets are going to basically help in improving the thickness and the vascularity, and this is going to help us to improve our overall success in terms of pregnancy. So you have to understand that if the patient has undergone a hysteroscopy procedure, so post the hysteroscopy procedure, even if they've gone ahead with a metroplasty, or they have gone ahead with a PRP installation or a scraping procedure, the endometrium is best in terms of the thickness and vascularity for around a 3 to 6 months period. So what we can do out here in this 3 to 6 months period, you can ask these individuals to try naturally or go ahead with the IUI cycle with proper monitoring of the endometrial thickness. So if this endometrial thickness is lagging behind